Welcome to another edition of the Dental Growth Partners podcast. I think we're on to episode 7 now, maybe 7 or 8. And we're going to talk about patient journey, something I really overlooked really coming into dentistry from a marketing, software, automation point of view. I thought, oh yeah, that sort of takes care of itself. But it's very important to have a really good patient journey from click all the way through to actually the procedure of what you're actually doing. And it's something which I've really learned about from Murray. He's really explained it to me a lot more. And it's something we incorporate into everything we do now within the practice and the practices we work with. So yeah, over to you, Murray, about the patient journey. Really, I think actually it's probably as important as anything else you do, if not the most important thing, is to have the patient journey a really good experience.
Yeah, I think that's yeah, dentists generally are really good at looking after the patient, particularly in the actual chair. But as a user of the dental practice, the patient only experiences the experience in the chair moment. This is a brief moment.
Yeah.
Actually, the bigger sort of journey for them is potentially discovering the practice. So they're sort of clicking on adverts, and they're going to speak to potentially the receptionist or some sort of automation sort of in our case, sort of starting to use that to sort of have an automated discussion and start to find out about the practice. And then they're going to potentially come in and see a treatment coordinator, and then they'll be handed on to a dentist. And
Yeah.
then you've got the in surgery bit, and then they might be handed back to the treatment coordinator or handed back to the reception team. So actually, for the patient, the experience as such is a lot longer than just the sort of few moments actually sitting in the chair. And this is a key part of sort of running a clinic, is making sure that that is taken care of in every step of the journey. And actually, that's one of the sort of key parts of being a sort of leader in your dental practice, is that coaching of your receptionist, coaching of your TCO, coaching of your dental nurses to make sure the clinic runs like clockwork. Being a dentist yourself, often highly trained to sort of deliver the treatment, but delivering it in a way that the patient actually enjoys, or kind of as much as possible sort of feels it's a high quality experience in the chair. And then then it's the handover and the follow up and the aftercare, how all their appointments are booked, taking
Yeah.
consideration of their life and how the dentistry is going to fit into their life. This is all sort of part of the patient journey experience, which is a key part of running a clinic. And I think
This is something I've had to learn as a marketeer
yeah,
as well, which I sort of overlooked it a little bit, but it's really integral to follow-ups and speaking, giving the receptionist to follow up and speak to the person a certain way, and that patient journey of making them being a patient myself for Invisalign. It really sort of hit home to you that you want to enjoy it. It wants to be a nice experience.
yeah,
And I'm presuming with some dentists, it's just in, out, so there's a lot more to it than just the automation, booking them in and
yeah.
like you
I think
say.
in terms of who we sort of look after, sort of the um, patient journey is even more important, because we sort of do marketing for independent private dental practices, and
Mhm.
essentially the sort of the model of that is, private dentistry is essentially expensive and should feel like a luxury experience. It's a sort of
Definitely.
optional. It's an optional way to spend your money. You could go and get something similar for you know a lot less with the NHS, but the experience will be like very rushed. So you want to make a very big difference between
Yeah.
what you can get and what you provide. So so it's absolutely key that your patient experience feels like a luxury experience. That it's like worth them spending that significantly more money. And also it's in other areas of their life. If they can afford private dentistry, then the whole way that their life operates, often spend time in nice hotels or take nice holidays, etc. So you want to be sort of emulating those sort of high end customer experiences. And no reason why dentistry should, it's highly important. So
Yeah.
it
High
should
ticket
be
items.
yeah should be treated as a highly valuable
I
service for
suppose
them.
I suppose also it's good if they have a really nice experience. Like myself, when I had a really good Invisalign experience, tell my friends about it.
Yeah,
So
that's like absolutely key. So if you do okay, people won't talk about it.
yeah,
If you go above and beyond someone's expectation, they're sort of got the wow factor,
yeah,
then they'll go and talk about it. And then that's actually, in terms of marketing and sort of word of mouth and sort of having influence in terms of attracting people, you have to be exceptionally good at customer service and the patient journey to make sure that people go and talk about it and say how and rave about it and how good it is. So yeah, as a clinic, you really want to be from a management point of view, sort of building that into every step of the process. And in terms of your marketing, it has to be
Yeah.
sort of every step of the process. So yeah, your presentation online, your presentation of the
Yeah.
actual clinic. So this is like all the
It,
signage, the kind of in the decoration, like everything presented has to sort of all
branding.
cohesively, yeah, it comes together with your identity that
Yeah.
this is all part of what you're
But
going to experience here.
so it's like the first point of call is probably for most patients is going to be the receptionist. So you have to choose your receptionist really well, don't you?
Yeah,
I would say.
exceptionally important role in a practice. I've worked in practices for over 15 years, and when you've got someone who's got the full skill set, which means they're extremely polite, they're extremely organized, they're extremely sort of yeah, on on the same wavelength as the patient in terms of
Yeah.
appointments, like organizing it, making sure that it's fits in with their life, all this sort of thing. Communication of costs, communication of timings, any delays,
Yeah.
yeah, everything, all that sort of care, but in a sort of
Trust.
yeah,
Yeah.
and I trust,
Create that trust.
yeah. So when you've got that key person and they're doing it really well, the clinic like runs like clockwork.
Well, I've noticed
But
here
if
with
you
Amanda, your receptionist TCO, it's like when the patients come in, they have like a conversation about non-dentistry stuff.
yeah,
They're interested in each other's lives and they get along, and
yeah,
it's a good experience for that person who's coming in, isn't it,
yeah,
patient?
so you've got to be a people person, and you've got
Yeah,
to be have someone who's basically interested and gets on with everybody. If you've got a certain person who doesn't want to talk to certain people or not interested, then that's just going to turn that patient off and just feel like they're treated in a cold way from the moment they come in. And then
yeah,
the next minute they're going to see the dentist and they're already feeling cold in the waiting room. Then they're going to come in and they're going to be a bit off, and then this
yeah,
doesn't flow. Whereas if they're sort of welcomed properly, they're kind of hosted properly, then passed on to the dentist. Dentist looks after them in the way that we're kind of talking about, and then handed back. Then this is how patients feel that they're really well looked after. But it comes from lots of effort, lots of understanding of the role, understanding of how people are, etc. So this is a key part of the patient journey. And particularly, I'd say in private practices, the independent private practices, often like family owned, like we are here, you can really sort of go above and beyond
yeah,
what the kind of average is, and that's where you get the wow factor, and that's where people
yeah.
start
Over
to
deliver.
over deliver 100%. It's the only way you're gonna create that reputation, which is ultimately sort of hugely valuable to the practice. And we're sort of talking about sort of patient journey, so you've got like it's a key part of also structuring the clinic. So I was saying that in that leadership role, you want to communicate that all to your team. But another thing I want to talk about today is how you actually structure that patient journey for different types of treatment.
So, so would you say also like a daily or a weekly meeting with your staff is a really good thing to do as well?
Yeah, you definitely that's the best way of keeping that patient journey as good as possible is having a morning what they call morning opportunity meeting.
Yeah,
So just starting your day 10 minutes earlier. So rather than start your day, everyone sort of sitting in the chair, as you start the day at the front desk and
yeah,
you talk to the receptionist, what are the problems from yesterday, anything to follow up, have we
yeah,
got all the lab work, have we got everything, is everything prepped, all the nurses are focused in on the patients we're going to see that day, make sure that everything is set so there's no drop balls during the day, plus you have an opportunity if anything's broken or anything like this from the day before can like be addressed by the management and
yeah,
by the dentist. Referrals are outstanding, you just quickly run through a list of all the things that need to be kept sort of
yeah.
on point
Any
to
problems, any
any
queries,
problems,
any
but you got to have that as a habit, so it's done every
yeah,
day and then the clinic runs properly. If you just essentially come in last minute, running 5 minutes late, sit down, everything, it's like you're already off to a bad that first patient
yeah,
is already having a bad patient
yeah.
journey
They're having a bad experience,
because
aren't they?
they're already seeing the dentist arrive late, they're starting their appointment late, they were on time, they're thinking, well, what's going on? So so this, I mean, occasionally happens obviously, but it's
Yeah,
but nine times out of 10, you should be having that morning opportunity meeting, getting your day off to a very smooth start, and it just creates that cycle where everything's just kept at a really high, really
Yeah,
crisp
it's a
level
really
of
good idea
patient
that
journey.
actually. It's a really good way of looking at it.
Yeah, so that's something that every practice really should be operating. But yeah, you'll find your patient journey takes care of itself if you're constantly talking about it.
Yeah,
Um, yeah, and that sort of feeds into the sort of the other topic we want to talk about, which was yeah, in the for the independent sort of owned practices, how you design that patient journey, but you also want to think of that in terms of the different types of patient journeys that people are having. So you have in dentistry, so essentially you have like your routine visits, like your exams, hygienes, etc.
yeah,
And then you've got your sort of treatments like fillings and crowns, and then you've got your bigger sort of things in private practice. Part of the whole uh, thing of private practice, you're providing advanced dentistry, so things like Invisalign treatment, orthodontic treatment, implant treatment, etc. And these are the sort of high complexity, also high cost,
yeah.
sort of for the patient, like highly sort of involved treatments. So you can sort of think, we can describe these as sort of the way the normal clinic sort of builds up is that you can imagine you've got like a jar, and then you sort of filling up with the exam and hygiene is a bit like the sand, and you sort of fill up like 60-70% of your
Yeah,
time with that, and then you fill up the sort of next bit with your pebbles, which are your sort of your fillings and your crowns, and then essentially you get your sort of rocks sort of forming, and you sort of get into advanced dentistry, and then you sort of stack those on top,
yeah.
and basically they're like falling off the top of the jar, and like you actually your patient journey for the highest value treatments is actually not the
It's
best
not good.
experience. You're
Yeah,
actually sort of preoccupied most of the time with the 70% of the routine stuff, which yeah is important, and those are sort of still very important. But the patient journey for the people at the top is kind of falling apart
mm,
because they're getting squeezed in. There isn't time for them, etc., etc. But those are the people doing the most complex services and should be in a way sort of people who are like looked after with the most amount of time because they're paying the most amount of money. So I definitely encourage anyone who's trying to structure their sort of independent sort of private practice to essentially you think about that jar as like your diary, and you put the rocks in first, then put the pebbles in, and then put the kind of the sand, the sort of routine bits in at the top. And actually, that's a much better way to structure the way you think about your clinic. And also from a marketing point of view, yeah, that's where marketing sort of comes in, because if you can say, okay, I've got time to do, let's say, an implant every day, then you block that time in your diary, and then you build your marketing piece to make sure that you're bringing in that kind of work, and you're then creating time in the diary to put in those rocks essentially in at the bottom first, and then you're filling up the other bits as they come in.
so you're covering all your outgoings
Yeah,
straight away.
so this is the business coaching bit of it. Is like
Yeah,
as a dental practice owner, you're on the line for multi six figure operating costs. So if I don't turn up to work, it's kind
yeah,
of eating a huge hole very quickly. Whereas if you know that your marketing is and your patient journey is such high quality that you're going to essentially be able to fill those big
those
big
yeah,
treatment items every month, then
yeah,
well, basically if I do those, like that's like five or whatever it is, but whatever number of those actually covers the operating costs, then you can sleep a bit easier at night because
yeah,
they're coming in. Whereas if you're sort of okay, work really hard all month to see all the exam and hygienes and all this, and then you do a little bit of the pebbles, and then you're like, oh, well, sometimes we do some of these, sometimes we do some of these. So yeah, sometimes we're up months, sometimes we're down months, and you're sort of wondering whether you're going to cover your operating costs. This is a much more stressful way to live.
yeah. Just concentrate on those bigger rock items, the high
Yeah.
ticket items,
So
and the journey and the marketing and
yeah, so then in terms of obviously practice evolve, so often you might sort of have, have inherited a practice, like but being an associate who then buys it out, or like in my case, build it up from the bottom up. So as a squat practice, so you sort of end up with a blend of things at the start. But ultimately, if you're trying to then design it, then you want to sort of move towards that model, because that
yeah,
model is
yeah, makes sense.
much more sort of easy to live with. Whereas if you're doing it the other way around, then yeah, so you're doing a lot of work, before you even cover your overheads,
Yeah,
and actually you're maybe dropping the ball on the people who are sort of really need the most attention.
Yeah.
So
Yeah.
this is kind of a key bit of business learning, and then that once you know that, then in terms of what we do together, like you design your marketing
Mm,
machine around
yeah.
that so that you make sure that you're bringing in people who need those, those rocks, need those bigger treatment
Yeah.
plans.
High ticket items. You're trying to. Yeah.
Yeah, and
Makes it makes sense really.
as a dentist, once you can do, things like implants, orthodontics, all these sort of things, more transformational type treatments, they're generally the bits you're kind of more interested to fill your diary with. So it actually makes sense to block out the time to make sure that you fill up with doing those. Um, Not to say the other bits aren't super important. It's just that, yeah, you need to structure your diary so that they all get done. But yeah, you've got enough time to look after people as and when they
So,
come in. If you want to,
also it would cover if you're doing it, looking at it that way. It cover if you do have a day off, or if you're sick or something. It's not a biggie. It's like you sort of covered yourself already
yeah,
with a bigger item. So everyone gets sick. Everyone things
yeah,
happen, don't
exactly,
they?
yeah, exactly. So if I say if you structure it more in that model with the rocks going in first, then yeah, you can sleep it a bit easier.
Yeah,
Owning your own
it makes
business, you're
sense
never
really.
never necessarily sleeping easy until you
Yeah,
covered your overheads. So yeah, so it's
it's all intermingles with that customer experience, that patient experience, um, of prioritize. I mean, they're all important, but prioritizing those higher ticket items, which gonna, let's say, make you sleep easier every month.
yeah, and that's the
It
difference.
sort of makes sense, really,
Yeah,
to create your marketing around that rather than the other way around. You create your marketing on volume,
yeah,
right, when it should be you should be creating your marketing around customer experience, patient experience, and higher ticket items, or evolving into that as your
yeah,
practice grows.
exactly. Yeah, so it often has to. That might be the model, and you're sort of
Mm.
trying to achieve more of that than that. But yeah, there's
So,
essentially
so there
that's
must
what makes
the
owning a private practice. Obviously, you don't have a difference between if you have got like an NHS or a mixed
mm,
practice. You're going to get in X budget per year of NHS treatment, so you kind of know you're going to cover your overheads. But it's just a different way of making sure that you're
so
going to get.
so there must be dentists out there who are highly NHS or highly on volume of smaller. But so this would be a way of evolving the practice over a number of years
Yeah,
of generating more income with higher ticket items. This is just one of the pillars of
yeah, just how
how you
you
can
evolve.
10x your
Yeah, how you can evolve your business so that
your
you
business.
can. Yeah, I'd say it's just if you can structure it that way, you'll just find that you look after, say, fewer number of people to
Yeah,
cover your overheads, which just makes life less stressful.
yeah,
Whereas if you have to do high volume of people just before you even paid your staff, paid your bills, then
it makes sense.
it's also psychological. It's like
Yeah,
you feel more relaxed if you know that.
working smart, isn't
Yeah,
it?
yeah.
Yeah,
So that model is something to aim for if you're a independent
yeah,
private private clinic. If you're, if there are different models, they will like make money, but it's just that's the model
yeah.
that
So
we would recommend you. And understanding that business coaching is what I would recommend if
yeah,
you were an independent private practice and you can do advanced treatments like implants, orthodontics, Invisalign, composite bonding, these sort of treatments,
yeah,
because
high ticket ones.
you can then build your diary and build your work around that model. Yeah, and I think for us, obviously, that's
And then even take on associates that can help you with that as
yeah,
well, type of
exactly.
thing.
And like I say, if there is sort of if you do want to then pass on the practice or you get really busy and busy, it's easier then to get associates in to come and do those rocks,
Mm,
and then you sort of taking again
yeah,
more load off yourself because they can come in and just do
yeah.
fewer things and help you out. Whereas if you're relying on lots of activity to kind of cover
It's burn
overheads,
yourself out, surely.
yeah, yeah, which is a risk as a
Yeah.
dentist these days.
Mm.
So yeah, so you're sort of just structuring your business, and it's a little bit of business coaching to understand that.
Yeah.
And
Yes,
yeah,
it's quite intertwined with the patient journey, isn't it?
yeah,
It's how you structure everything to make it easier to cover your costs. And it all comes back to that patient journey, isn't it? Of
yeah.
nurturing your bigger, higher ticket item people, making them more important.
Well, that analogy of the rocks being on top
Yeah.
and falling off, essentially, the reason we're talking about it is because that when they're falling off, we're talking about them not being
Yeah,
not
looked
being looked
after. Yeah.
after properly. So we're talking about, they want to book in and there's no time for them for that. There's a waiting list for like because it's full of checkups, and so actually if chap who wants to implant kind of wants to do it this week and he can't
yeah,
do it, and
yeah.
it's urgent for him, it might go somewhere else,
Yeah, so as from
or
a marketeer, it's like you want to get as many people in as possible, get a waiting list, and it's not always the best policy, is it?
no, obviously, like demand is important, but you also you're a luxury service,
Yeah,
so you need to have, although you want more, you've got to have still
the
make,
right more.
yeah,
Yeah,
exactly. It's kind of yeah, which is a key part of yeah what we do for people in terms of make sure that they're getting consistent leads, as
yeah,
it's like talk about sort of interested people in what they do, but it's kind of structuring that all to actually fit in the model, which then is going to make your practice run efficiently and smoothly, and yeah, make it enjoyable for the dentist. Like you've trained for such a long time to do some of the things you're doing. If you just then build a sort of a frenetic kind of day to day that
mm.
you can't enjoy, then yeah, if you think about it and structure it better, then you're going to enjoy your work a lot more. You're going to
Yeah. And
enjoy
I suppose that's well, as we know, working with different dentists and that it's not an overnight thing that happens. You have to work on it over a number of months and years, really,
yeah,
to turn that ship around.
yeah, yeah, which often is like conceptually difficult for dentists who are looking to make changes on their dental practice.
Mm.
They kind of I don't think they understand how slow change takes. They kind of want instant sort of sign on with a new marketing agency, and you'll be like after 2 3 months, you'll be like, well, I'm not doing 3 times the amount of procedures. And it's
Yeah,
like, well, you're gonna have to build your reputation for 2 3 years
yeah.
in the local area to then
It's
be doing it. So
It's
it's
that
like,
noise, isn't it, of the
yeah,
whole thing. It's not just what you're concentrating on, it's the
yeah,
whole noise of if you've got Google ads running, you've got Meta ads running, IG ads running, you've got leaflets, you've got passers-by, you've got an A-board outside where people can scan.
yeah,
You've
got
got
high,
newspaper ads, you've got publicity going out into the tabloids. The whole picture, isn't it? The
yeah,
whole noise.
and that's then going to match the patient journey.
Yeah,
Like the in-house has to be sort of working extremely hard,
yeah.
exceeding expectations continuously
Over deliver.
while that
Yeah.
noise kind of builds up, and this is how it sort of takes form. But yeah, it's that yeah, some people sort of able to kind of understand that, and they sort of on board with the team, and they sort of go along with it for long enough to see it happen. Which is yeah, where if you just sort of think you're going to sign up to like some new ads or some new
Mm-mm.
marketing, and it's going to sort of
Changing it
make a
overnight.
big difference to your clinic,
Yeah, it takes a while.
you will see things happen, but it takes a long time to yeah, to really build up reputation, patient sort of
I,
trust, all that stuff.
I
So
think you have to, as a dentist or any business owner, you have to invest in the process.
yeah, yeah,
Definitely.
yeah,
Not expect. I mean, you can get some really good results straight away, which you will do. You will get some good results, but the big results, the results that last, is over investing in the process, investing
yeah,
in the marketing, investing in your staff,
yeah,
everything.
yeah.
Your own training.
You're gonna
You know,
primarily, yeah, you probably invested a huge amount of time and money into your own training. Then you've got to invest in your practice. So you've got to have a high quality environment, make sure that it's like renovated to a high
yeah,
standard,
yeah,
decorated to a high standard, equipment's all sort of
yeah,
newish and working how it should be. Yeah, your cleanliness has to be exceptional. Like all these things, and yeah, and then on top of that, yeah, you've got to invest in probably staff that are the better quality staff who've
yeah,
got a bigger skill set, got experience. Then yeah, you're investing in sort of yeah your presentation, so your shop front or your kind of presentation of your building,
yeah,
all your marketing, sort of in-house marketing, sort of emails, leaflets, sort of all the in-house touch points, and then you've got your online stuff, so your
yeah.
website, yeah, social media accounts these days. So yeah, probably Instagram page, Facebook page, etc. So there's a
Creating
huge,
content.
you
Yeah.
can't build that overnight. You're sort of building towards it as a dentist over, as you
But
work through your career.
But
But it's
I think the takeaway from this podcast that we've done for me, and I'm presuming for lots of you dentists out there as well, is that um, you've got to invest in the patient journey.
yeah,
You really, it's so important. I can't stress how much it is. I've learned over the years, whereas it's something I just took for granted that, but you can invest in all this marketing, invest in your staff and that, but you haven't got that patient journey, you're gonna lose patients, you're not gonna evolve. It's such an important part of it, I think.
yeah. Yeah, and I think as dentists we kind of know that instinctively or naturally, like a caring person. It's just how you uh, evolve that from the chair side experience to yeah, in our case a clinic experience. So it's
Mm.
the every single touch point in it, and yeah, and then going above and beyond, in terms of effort, it has
Over deliver.
huge result in terms of how people feel about how they've been treated.
Yeah.
So yeah, so I think that's the key sort of message, and hopefully what I described in terms of how it then translates into how you structure the actual like treatments and things you provide, and the sort of priority you put through the diary, etc. It really give you a deeper understanding of the level you got to go to understand how to run an independent private practice in a way that's profitable and enjoyable, and ideally sort of
Yeah.
make the most of your career, because that's what we're all sort of aiming to do. So hopefully that's been useful.
Yeah. I've taken something from it, and we deal with it every day. And
Yeah,
um, yeah, just it's just another pillar that you really have to concentrate on. That I presume a lot of people don't even think second about. That's going to take care of yourself, but it's a really important thing, that patient journey. So hope you've taken something from it. Hope you've enjoyed it. Myself and Dr. Murray Pratt. Don't forget to like and subscribe. Hit that bell notification so you'll never miss another one of our podcasts, one of our videos. Leave us a message. We're always there to answer your queries, questions, and we'll see you for the next podcast.